Good afternoon. Welcome to today's meeting of the Health and Wellbeing Board at the London Borough of Hillingdon. The meeting is being broadcast on Councillor's YouTube, Hillingdon, London. My name is Councillor Jane Palmer and I'm co-chair of this committee. So welcome should anybody be watching from their home. Before we start, I've got some important housekeeping, if we wouldn't mind. Can we make sure that our mobiles are on silent, please? We're not expecting a fire drill, so if the fire alarm goes off, follow officers out the building. And please can we remember to keep our microphones muted when we're not speaking and then unmute to speak. Thank you very much. So we will now move on to the agenda. Agenda item 1, apologies for absence. Nikki, have we got any?
Chairman, we've had apologies from Richard Ellis. We've had apologies from Keith Spencer, Councillor Sue O'Brien and from Derval Russell.
Thank you. Agenda item 2, declarations of interest. Other than those already on the register of interest, have anybody got any declarations on the matter being discussed this afternoon? If you do, can you please state? I'll take that deafening silence to mean that there is no declarations of interest. Thank you, Nikki. We move on to agenda item 3, meeting of the minutes on the 13th of June. If anybody has any comments on the accuracy of the minutes, could they please indicate? I'll just give you a few seconds because I'm sure we've all read them from cover to cover. If nobody wants to comment on that, are these agreed? Nods all round, thank you very much. Exclusion of the press and public. I can confirm that items 5 to 7 will be considered in public and items 8 to 11 will be considered in private. So that brings us on to the main agenda. Agenda item 5 is the Health and Care Performance report. I think that's Gary. I think that's you. You're looking at me. I'm looking at you. Does that mean we can have you just give us a little chat on it, please?
Thank you, Chairman. Just a few points to highlight to the board, starting with the BCF submission. Just to reiterate that the value of the BCF for 23-24 is 96.5 million, and provisional value for 24-25 is 98.5 million. I wanted to make the board aware of some of the feedback that we've had for the assurance team. Suffice it to say that the plan has been submitted, and some good news is that I understand that all London plans have been recommended for assured status, so we would actually just be awaiting for written confirmation. The expectation is that our written confirmation will take a little longer because of delays in submission. But some of the changes made as a result of feedback from the assurance team. So there are changes to the avoidable admissions target, which will actually make this more achievable, and does actually impact on some of the feedback later on in the report. There's changes to the rationale supporting the discharge to usual place of residence metric, which essentially corrects an error that was in the text. There is actually no change to the target. There has been some additional text added to the narrative plan document, which supports data in the intermediate care demand and capacity worksheet in the submission template. There was basically, we didn't have enough words, I think would be a good summary of that point. On the subject of the intermediate care demand and capacity worksheet, there have been some changes to the the Pathway Zero demand figures, and Pathway Zero is actually the vast majority of people being discharged from hospital. The demand figures have now been changed to reflect people actually requiring low level of assistance rather than the total number of people being discharged on that pathway. So as I was saying a moment ago, expectation that we will receive confirmation of assured status. Once that's happened, we can then enter into the legal agreement under Section 75 of the 2006 NHS Act, which will then mean that we are compliant with all of the national requirements for the Better Care Fund, and my expectation is that will be concluded by the end of November. Are there, through Chairman, any comments on any of that or questions?
I just want to say, as I say every time that I look at something like this that you and your team have produced, it really is an excellent piece of work, and we are very grateful to have somebody so knowledgeable in front of us. It has been quite difficult this year for reasons that I'm not going to go into on this meeting, otherwise I could be here for some considerable time. But under very difficult circumstances with what's going on in North West London, this is a really, really comprehensive piece of work. So my personal thanks for all the work that's been put in on this, Gary. I know that you will have had many sleepless nights. You have worked many hours outside your paid job, and it would be remiss of me if I didn't acknowledge that in public. Does anybody have any comments? Professor Good.
So these may be seen as somewhat pedantic, and actually Jason may be able to help with answering them. On page 15, there are 3 graphs about A&E attendances, emergency admissions, and over 65 emergency admissions. And I suppose they're interesting that they show the pressure that the hospital's under and the increase. I just wonder, would it be helpful to actually have a graph that shows the change in percentage of patients admitted against those who actually attend? Because we don't know what the baseline is, and it may be that admissions are going up, but the percentage of admissions compared to those who attend is actually going down, which shows that the A&E team are working harder but actually not winning the battle. Does that make sense? Oh, turn that off.
There we go. Thank you very much, Chair. So, what should we do? So, if we look at this meeting here as almost in terms of assurance, I think if we at Hillingdon Health and Care Partners Board almost did a deep dive, because you're right, I think there's a piece about the trends in population need and how people are using their health services, but then equally when they get to the hospital, how the hospital is treating people. So I propose, Chair, if it was all right, whether it's something we take back to the HHCP board.
A second question, which is even more pedantic, and that is, if you look at, again, page 18, on the discharge usual place of residence, it says the Q1 actual was 92.18%, of the target 92.8%. Yet if you look at the table higher up about first discharges, it says that of pathway 2, 4% of hospital discharges were on pathway 2, and 1% on pathway 3. So I don't understand how we get to 92% as opposed to 95%. I said it was pedantic.
Can somebody answer that, or do we need more time?
All I can say, Chairman, is that our data comes from different sources.
Is it possible to find out sort of where that discrepancy comes from? Thanks.
Yes, Chairman.
Okay, so we'll have some clarification of that, and if the answer can be sent to Nikki, then we can get that. I don't think it is pedantic. That's a good one. I think it's absolutely fine to be able to ask a question like that. Any other observations or comments on what I've already said is an excellent report? Gary?
Chairman, I would just say that, suffice it to say that this year has not been without its challenges. I just wanted to highlight a couple of points about the BCF scheme reviews that are actually going to be undertaken, and set out the parameters of the review of those reviews being undertaken by North West London. Understand that North West London have actually engaged an external organisation to undertake the reviews. I think just to highlight, I think the importance of the key lines of inquiry within the BCF planning requirements not being lost in a focus on concentrating on the metrics, and specifically in relation to Care Act responsibility implementation and addressing equality and inequalities. Also highlight for the board, which other partners will of course be aware of, is the intention to complete our own review, place-based review of out-of-hospital spend and BCF schemes, which had already been agreed prior to the decision of North West London to undertake a review, and the intention is that will be completed by the end of October, and the results of both sets of reviews brought to the next board meeting. Thank you, Chairman.
Thank you. And just to probably wrap up, unless anyone's got anything to say, I was at an ICS meeting on what's his day of the year? Wednesday last week, and we actually, as 8 London Boroughs, there was actually an apology given for the way in which that whole BCF had been handled. So we have had an apology and an assurance that it will not be like that again in the future. So that has been minuted. So I suppose that's what we call progress, and that's certainly what we call partnership. But why you got my thanks is because I understand from my own borough's view that we were very well ready to go for deadlines, and through no fault of our own, that didn't happen. Any other comments? If nobody else... I'm so sorry, I'm ignoring my social care colleagues who are waving madly at me. Sandra, please. One of you.
Thanks, Chairman. I have my own waiver. I didn't think that day would come. I've made it now. I just wanted to raise the point, just because these, you know, for those that have been coming for however long this has been going on, since 2013, thereabouts, Wellbeing Board, I think, you know, we've year in, year out sort of had this in front of us, and, you know, I'm pleased that you've raised it, because I was going to, about the work that Gary does for us. I mean, and we're not just saying it, we're not flandelling Gary. I mean, it's brilliant that, you know, you put into it as much effort as you do. And I suppose I was thinking about it in terms of, you know, when people talk about Steve Jobs and Bill Gates and that sort of thing, and when the nerds had their day. It's a bit that. So, no, take it positively, though. It's like, you know, Gary's been beavering away. Well, look at them now. Who wouldn't, you know? Well, not Steve Jobs particularly. But, you know, I think it's the point that all of that sort of heavy lifting that's been done over the time has put us in the position now where actually these things are starting to shape into the things that define the future, in terms of the integrated nature of service delivery, and the foundations that we've got have played out through this year, And you're right, and I'm pleased you raised it. There was a whole sort of hoo-ha about the signing off of these things, but actually from the start, I think we were in such a strong position because of the work that, as I say, particularly sort of, Gary's done in compiling it all for us, but again for the partnership really in terms of the forethought in some of the work, particularly around the pathways. And actually I'm pleased that Gavin's here as well, because the work that Gavin's done around hospital discharge and, with the system is, it just puts us in such a good position. And I think it's easier that these things just kind of come and go and we just tick them off. And but as I say, I think our day is coming where all of that hard work is now putting us ahead of the game, I think, in terms of how we're going to be constructing ourselves into the next iteration of the system. And the review for us is positive. It's not a threat. I think it's an opportunity to showcase kind of what we've done and to put ourselves in the driving seat. So well done to team and partnership, I think.
Definitely, and whilst I think I've heard Gary just call a nerd, which I must just have to challenge there, Tony. I think that's probably a little bit unfair. But I do also want to say that whilst Gary has done a huge amount of hard work, it is thanks to our health colleagues as well that we are able to sit round this table and produce a document like that. It's not just done through one person, it's done through the best example, I would say, in North West London of partnership working with our councillor and our health colleagues. So I don't mean to slant it onto the LBH. It is because of my colleagues on the right and in front of me that we actually are able to sit here, and I'm able, when I'm at these meetings, to bask in some sort of glory that what we're doing here, we're doing well. If nobody else wants to say anything on that, we can we accept the recommendations in the report? And unless anyone's in favour, I will move on to agenda item 6, in which case I am now on agenda item 6, which is the Hillingdon Safeguarding Partnership Annual Report from 2022-2023, where we're going to look at the achievements. It is an excellent report, and I'm going to hand over to Susie Gladys, who's going to talk us through it. Thank you. It's a really good whistle stop, and I don't mean that to be demeaning of a very, very comprehensive professional piece of work about safeguarding. It's an excellent report. I'm pleased to see that, it's all about learning from practice as well. There's no point doing a report like this and saying it's absolutely brilliant. We need to learn. I know at first hand the importance of the IDVAs in hospitals. What I'd like to see, because I know that we don't get as many referrals from GPs. I'd personally like to see IDVAs more involved in GP surgeries, but that is not for a conversation today. I'm just raising that. A really, really good piece of work, and I think for me, what I'm pleased to see, the highlighting of self-neglect in adults. That for me is important, that we're beginning to talk about that doesn't always come intentionally. If your mental health's not great, that you're not looking after yourself, it is a self-neglect. So I'm pleased, if I can use that term to talk about neglect, to see that quite a high focus in this report. Really, really good report, Susie, thank you. I hope some people around the table are going to make comments this afternoon. I would not want this report just to go without some comments. So does anybody wish to say? Vanessa, please, thank you.
Thank you, Chairman. I don't think this one's plugged in, which is why it's not working. So hopefully you can hear me. So yeah, I absolutely echo what the Chairman said about it being such an excellent report and actually bringing out the themes that you've picked up throughout the year. I guess more comment, but kind of question, was particularly around the kind of voice of the child or the voice of the adult, and obviously that is one of the priorities for this year. I just wanted to know if there's something more that you need from partner organisations to do that, because obviously that's why we're all doing what we're doing, but keen to kind of think about what other action we could be taking.
Anyone else? Professor Goodman?
So this is just a question that I possibly should know more about, but how much liaison communication do you have with the Hillingdon Training Hub? Because I noticed you said that there's an increase of 40% of training for professionals, and I wonder how much that went into general practice and how much you're doing with the training hub, because I think that's a fantastic resource. It's very well attended by GPs, and as Councillor Palmer said, we probably don't pick up as many cases as we should do, and if we can have a comprehensive programme working with the training hub, we may be able to pick up more.
Lynn.
Thank you. It's a really excellent report. Thank you very much. At Young Health Watch, we've done quite a lot of pieces of work with young people, maybe not so much troubled people, but people with issues, for example, self-harming, and we did quite a big piece of work on young people's sexual health. And I just wondered how you've linked in with Health Watch and how we maybe can join together some pieces of work and, you know, little bits of market research as well.
Anybody else want to make a comment? Tony.
Thank you. I've learned how to waive, indeed. Well, my waiver neglected her duties. So just to, I know it looks like I've done a course on be nice to people, but and I'm just sort of going through the motions, but I'm not. But to thank Susie, I think, for the hard work that goes on, because it's a small team that do an awful lot of work and coordinating across the different organisations, and I think it's been a little bit painful at times, but I sit on the executive leadership group along with, you know, the new arrangements that we have, and I can see by virtue of how the tone of that actually, and the fact that we've been rotating the chairing of that group across the anchor organisations. I know that's been happening at the sort of board level as well, which is great, because it just shows there's more buy-in from the system, which is great, because that's all going to be for the benefit of, you know, adults and children, sort of in this case. So again, sort of putting on record thanks to Susie and team, but yeah, brilliant work. Thanks, Susie.
Definitely. I mean, I've definitely seen the depth and strength of this report in my time within the council. I've definitely noticed a huge change in the way we report safeguarding, the evidence, the fact that we are engaging with well, I'm going to use the example of the children in here. They're writing bits of it themselves. That is a massive development for a report like this. When I first came into this council, it was quite a short report. This has depth. You can feel it. I can feel it. Let's own it. I can feel that this is a very good report on a difficult subject that we should all be well aware of. So thank you very much. Are we happy with this report? I don't know, what do we have to approve it? Approve the recommendations, I think is what we should be doing. Is that correct?
Nice if our recommendations would say that people are happy. Maybe we should make that a language.
Well, it's obviously your language of the day, Tony, isn't it? So, I mean, yeah, I mean, I would hope the minutes and would record, you know, what's being said here about the reports that are coming forward. But I think, unless I'm mistaken, we accept the report and we move the recommendations contained within it. Thank you very much. Does that take me on to agenda item 7? Very quick. The board planner and future agenda items. Okay, so I just want to say that I think I want to. Is that where I'm adding something? It is, isn't it? Yeah. The health and wellbeing strategy will be coming before the December meeting. I think I saw an email from you, Sandra. Am I right with that?
28th of November.
So, yeah. 28th of November. Okay. And I also just wanted to talk briefly about another item. I might need, Sandra, your memory with me, because I've forgotten to bring my notes around it. But at the Safeguarding Hillingdon Partnership, last week, we spoke about, I think it was the drug and alcohol work, and my view is that, and I hope Sandra's, is that that should come before this committee at some stage. Am I correct in that, Sandra?
So before the Safer Hillingdon Partnership Board last week, you saw the first iteration of the Harm to Hope strategy on combating drugs and alcohol, and it was agreed at Partnership Board that we would bring that to the December, which is 28th of November meeting, for everyone to view and be aware of and clear about.
Nice to know that I'm not completely losing my memory. Thank you, Sandra. It's difficult not having my notes in front of me. So, did you get that minuted? Lovely. Does anybody else have anything they want to add or talk about on the board planner? 3:10. I can't believe we're on this agenda item.
We've got part 2 to go yet.
I know. Happy? Okay, so that brings that to a close. That's the end of the public meeting, isn't it? So that I'm going to say is the end of the public part of the meeting at 3:10. Thank you to the members of the public who have been watching on YouTube, if anybody is out there. Can I ask that everybody in the room remains silent until my colleague from Dem Services has confirmed that the live broadcast has ended and the loop has been switched off. Thank you very much.